Hey, y'all, welcome to our show. We had technical difficulty over the last few days, last week. So we switched format. We've got some other people involved that spend more time in this realm than we do. We are streaming live on YouTube right now. I will give you details once we get this thing going of how to actively engage, and hopefully we'll still catch you on Facebook, but we're going to start pushing people to our more stable platform so we can get through it. Dr. Derry.
All right. Hello, hello. It's nice to be here, and it's nice to be doing this. I missed you last week, Doc Griggs. As we slowly start to build up our show, I think as we always do, let's get started with the numbers. As you can see here, Doc Griggs, we are well north of 3.6 million cases globally. Of course, this is a huge underestimation. With 251,000 deaths. Overnight, we added 68,000 cases. Usually it's about 70 or 72, 73. So it's a little better with about 3,000 new deaths. Usually that's about 5,000. So it's gotten a little better. And here you can see what looks like globally, we are stabilizing the number of total cases we have right here. And then when you're looking at reported deaths around the world, it's hard to tell where we are. Hopefully this looks like this is declining as we are seeing stabilization, but again, it's super hard to tell. I think, as we are in the middle of a pandemic like this, it's kind of hard to guess where we are along the epi curve while we're in the middle of the pandemic, but still, it looks like to me, if I were to make a guess, that there is an element of stabilization here. When we look at the number of cases in the US, we have long since surpassed a million cases. We're well north of 1.2 million cases with about 69,000 deaths. Overnight, we added 18,000, almost 19,000 cases. That's usually about 20,000 cases. And the number of deaths has gone down, fortunately, about 737. But as we have been saying for some time, expect those deaths and cases to be going up as we've been seeing the states start to reopen. Just by juxtaposition, I'd like to show that we have surpassed the Vietnam War in terms of mortality. They keep saying that this virus is an enemy. We need to treat it like a war. So using these war statistics, I think, is appropriate. So World War I, we lost 116,000 men. That was, at the time, that was an unprecedented number. Just to show you where we're at, we're about 70,000 deaths. So we're going to be rapidly approaching that number, unfortunately. And I hope to all hopes that we do not get there. In terms of cases, as I said, it looks like possibly this may look like that we've reached hopefully a peak. Maybe this is hopefully something we're coming down. I suspect that this is going to come down and it's going to start climbing and going up again. And you can see the mortality is hanging pretty stable into what looks like a plateau. In terms of testing, we're testing at about 22,000 tests per million people, behind Belarus and above a country called Andorra, as well as Hong Kong. And Hong Kong was one of the leaders of testing, but their epidemic has kind of chilled out, so they're not doing as much testing anymore. This is a new slide that I'm adding from COVID tracking project. And what this is essentially looking at is the number of positive tests, the number of negative tests as well. And so what we see is that not positive and negative are about 7,000. And what we want is, if you look at the number of positives, about 1,000 over 1 million over 7 million, that is roughly 10%. Let me see real quickly. I actually did my math wrong when I first looked at this.
16, 17%?
I think it's a little less than that. Let me just see really quickly. I did my math wrong here. About 14%. That what that number is telling us is that about 14% of our tests are positive. That number should be around 5%. And so that's a key number to, so that just means that we're still testing people who have, high test probability of being positives. When we're looking at our case rates, we can see that we are right now 1, 2, 3, 4, 5, 6, 7. We're 7th in the country for cases, and that's 6,363 cases per million people. And when you look at our mortality rate, we're 1, 2, 3, 4, 5, about 443 cases per million people. I expect that we're going to start seeing these case rates and these mortality rates changing very, very rapidly as we start to see new states come online, especially some of the rural states as well, as they start opening up as well. In terms of testing, Louisiana is 1, 2, 3, 4, 5, 6th in the country for number of tests per million people, with Rhode Island and New York constantly kind of outdoing one another. Here's a new person in North Dakota. Is a new player. So is Utah as well. So it's good to see folks are getting out there testing. Looking specifically at the epi curve for Louisiana, you can see this curve more or less is kind of stabilized. We've had total 29,000 cases and about 2,000 deaths. And here you can see the deaths. I think we're starting to see a trend of going down. We've been talking about the fact that it's going to be going down for some time. As it does follow, as this plateaus, we expect that the number of cases and the mortality rates to go down. These are our updates here. So before we go over any of those updates, I just wanted to give Dr. Griggs an opportunity to kind of respond to any of this information. You're mute.
Unmute. I want you to go back to your slides, please. You said, first of all, I want to define for our audience what an epi curve is, as opposed to the what when you say epi curve, what exactly are we looking at, and what does epi curve mean?
The epi curve stands for epidemiology curve, and what the epi curve is reflecting is the number of cases. So this is on the y-axis is looking at number of cases, and the x-axis is looking at over time. So when we talk about an epi curve, what we're really looking at is number of cases as measured per time.
So the y-axis, folks, is when he's talking about the line going up where it says 0, 1,000, 2,000. That's called the y-axis in math. And where you see the dates going horizontally straight across, that's the x-axis that he's talking about. The epidemiology curve, epi curve that he's talking about is epidemiology. It's a branch of, it's a numbers branch of public health that we're talking about. So what we're showing you is what we're seeing, what we're using on this side to take a look at what's going on in the general population with regards to the number of new cases and the resulting deaths. Now, you had the new slide that you put up that I want you to go back. You made a quick mention that there's a number that should be 5%. Can you explain what you mean? Why should it be 5% as opposed to, I forgot what you said it is, but it's obviously more than 5%.
Right. So when you look at the number of, so this number here, 1 million tests here versus 6 million tests here, when you add the two of those together, you have about 7 million tests right here, right? And what you want is, you know, that you're doing a good job with testing the general population when your positivity rate is less than 5%. And all I did was just a quick kind of back of the envelope math right here. And what we're seeing essentially is when you take 1 million and divide it by 7 million, essentially you're dealing with, that's about 14%. So the positivity rate essentially makes up 14%. And again, we want that to be less than 5%.
So with that, I want to get to the why. Why 5%? Why does that, what is a good rate versus a bad rate, and why the 5%? Why are we trying, how do we, what significance is that?
Well, you know, countries that have had their positivity rates to be less than 5% are countries that have their coronavirus under control. Their local epidemic, their local outbreak have been better under control when their positivity rate is less than 5%.
So that's what you mean. It's not necessarily a number comparison, folks. It means that we're doing a good job of trying to, basically, we're doing a good job of containing ourselves. And by containing ourselves, because the virus doesn't spread the virus, people do, that we're doing a good job of social distancing, wearing masks, washing our hands, and really following what we know that works. Again, we've only known this virus for about 6 months. And I keep using the analogy of a puppy. So before anybody misquotes me, I'm saying puppy. Why? Because my daughter just got a puppy, and that puppy's 2 months old, maybe 3 months old. And we know nothing about what it'll be like as an adult to make predictions about it. Even though it came from a litter of other puppies, they're still puppies and other dogs. It has its own individual personality, like this virus is tending to do. So, and Doc, you see where I'm going with all this. So for us to try to make definitive statements about what we will be able to do a year from now, for a lifetime, based on what we're seeing right now as we're collecting data and still studying its behavior and learning how to approach and attack and potentially contain it, wouldn't be fair to you. And it's definitely not putting an unfair expectation on us, because there's a lot of things that we simply don't know. The scientific process is long and can be tedious and can be painful sometimes, which is what we're going through. I think, Doc, we said we're either in the first or second inning of a 9-inning baseball game. So I know that we're all anxious to reopen, and I'm throwing up against the rim, at the rim again, Doc. It's the same stuff we've been talking about all weekend. Is we have to understand that this is part of the scientific process, which is a bunch of successes, few successes, a lot of failures to get to where we're trying to go. Doc?
Yeah, I mean, the idea of reopening to me just seems to be, it's just not consistent with prioritizing the public's health. But that's my bias, and I like to lead with my bias. And I understand that people feel as though that opening is the thing to do. I just fear that we are going to see a lot more cases going up, and we're going to see a lot more mortality. And something that defines or differs the U.S. From the rest of the industrialized countries is that the other industrialized countries actually had safety net programs that were available for small businesses, for people. Mortgages and rents were deferred, and so folks felt they didn't feel that anxiety to go out. So while I do understand, why folks do want to reengage in society, I read you this morning on a previous program that we did together how the country's roughly at 20% about wanting to leave. 20% will go to a bar, only 20% will go to a restaurant, only 20% will go to a bowling alley, only 20% will go to the movie theater. This is largely because, I think people are aware that there's still a virus that's circulating. And if they go out into the community, there's really nothing they can do to protect themselves.
Yeah, so that, with that frame of mind, just from a science perspective, understand that we are part of the community too. Doc plays upright bass in a band. How cool is that? I know he misses that. I miss going to hear him play. He's actually really good. I miss being able to go to festivals. I miss being able to go visit my family in North Carolina. I miss dapping people up and hugging them, but we won't be able to do that until we have public safety. Herd immunity is a term you hear us talk about all the time. The magic number is about 70%, to the point that this virus can no longer harm us as a population. The problem is we don't have any natural immunity or artificial immunity right now, and everything that we're doing is part of the science. I don't like using the term experiment because it's been abused and people have been hurt by that term in the past, but this is part of a scientific process of discovery, and now we're doing surveillance. We're doing everything in public health, basic science, and healthcare. We're all working together, as we are with you in the community, to try to figure this out. So our job is to bring this to you every day and to try to decipher it and explain it in ways, hopefully, that we understand and that you can understand and you can give back to us. It's the communication dialogue. A lot of people get it confused, Doc. They think it's sender, message, receiver, and it's actually a two-way street. There's two other factors involved. There's the environment and there's distractors, but most importantly, there's feedback. So the sender and the receiver can walk away with mutual understanding. So we need you to teach us better ways to be here for you. If that makes any sense. This is called servant. We're trying to be, we're doing our best to be leaders, but it's called servant leadership. Tell us what we're doing wrong. Tell us what you don't understand. Tell us what you want us to research and explain, and we will do it. It's our obligation as scientists. It's our obligation as doctors. It's our obligation as people, members of the community that have the ability to try to help as many people as possible. I'm stepping off my soapbox, Doc. I'm getting down. Now I'm off my soapbox.
Whew. Really? Wow, that's amazing. Oh. Hey, let's take a moment and remind people that they can ask questions. And also, hey, do you want to talk a bit about our new podcast?
I want you to talk about our new podcast because you had an amazing interview this morning, and you can give a little bit of the origin of it, but especially the quick updates part of it. Like it's the micro version of this.
It's the 8 to 10 minute version. We have a podcast.
All right, pay no mind. Do not look behind the curtain. Pay attention to that.
I thought you were stepping away from your soapbox. We have a podcast. It's called Noise Filter, and right now it is up on Spotify. It'll be available every morning at 6 a.m. And it's about an 8 to 10 minute wrap up of COVID-19 news and things that you should know. Doc?
Yeah, that's every day, folks. It's every day. You go to, is it noisefilter.com?
Noisefiltershow.com.
Noise Filter Show. It's still new to us too. Give me a minute. Bear with us. Noisefiltershow.com. It's on Spotify. Filtering out all the noise. We'll push it on social media as soon as give us a minute. Some of the older of us need to catch up with technology. Doc. Anyway, check us out. Noisefiltershow.com.
Well, dude, I'm gonna just spray some of this right onto your image right here. Hang on. Yeah, hang on. There we go. Cleaning you up.
You got mothballs in your pocket?
All right. So you sent me something like this just about an hour ago.
Yeah.
Trump administration projects about 3,000 deaths daily by early June. Like, this is insane, right? I mean, we're at 757. And I have to wonder if this is a function of the fact that the states are opening the way that they are. So really
I absolutely agree with you, Doc. I think so.
Yeah, and it's something. Yeah, and if so, why are they allowing that to happen? Like why? If this is something that it seems crazy, but 3,000 deaths is kind of crazy. Today was a notable day. The Supreme Court heard its first arguments by phone, and what was even more notable is they allowed the public to actually tune into that. So that's something that's new, and it's good to see that while the Supreme Court is at work, Congress isn't. The Senate met today as well in person. Which is kind of crazy. And the Louisiana delegation, state and House, are meeting in person as well, which I am particularly concerned about. We're starting to see cruise ships are starting to come back into business, which again is absolutely crazy. We're seeing states now outline criteria. California, Louisiana, certainly New Orleans has as well. I think the last interesting story here is that intelligence officials backed Trump's assertion that they downplayed the virus threat in January. And that has me somewhat concerned. I bet you that that's not the case at all, because I've seen a lot of stories that the intelligence officials actually knew what was happening. And now they're starting to change their story so that it corresponds a little bit more with Trump's assertion that he didn't know what was happening. Of course, this is ironic given the fact that he says that he knew all along. However, I think he's just trying to, recognize he's doing some damage control right now. So
I want to go back to those slides. You went over the dailies. I didn't say anything about them. I want to go back to those slides. That's all right. So what I want people to, the big picture I want people to see is that we are now living in our COVID-19 normal, and we need to accept it. There's going to be good, there's going to be bad. Change and growth, whether you want to or not, is painful sometimes. If you've ever heard of Osgood-Schlatters disease, it's a bone condition that happens with kids, men and women, when they experience puberty and they have growth spurts. We are in a growth spurt and it's uncomfortable. We are forced into a new age and forced to have a new lens on the way that we live. And we've never lived like this before. And we probably in our lifetime never will live like we used to. Again, the fact that the Supreme Court heard its first arguments by phone, the fact that the public was involved, that's not necessarily a bad thing, actually. That's showing that we are adapting and it's an opportunity to change. So as people are at home, I want them to think about, instead of focusing on what you can't do and don't have, focus on the opportunities, focus on what you have. Carnival is criticized for its outbreak, plans to restart summer cruises before the summer. Of note is all of the cruises out of our port in New Orleans, just read before we went on, have been canceled. To let you know, there's two sides to every coin. Some people are erring with science, some are erring with economy. You have to find this whole reopening is a natural part of the scientific process, believe it or not, of attempting to reopen something that's been shut down by science. When you talk about epidemics, when you talk about previous pandemics, if you go look back through history, the reopenings have always had protests and they've always been painful because you have to balance economy versus health. And if you don't let health lead, you will have no economy, and that is biased of me because I'm all for science, and I know we all need economy. But again, this is all part of the growth process. If you'll notice, if you listen to Governor Cuomo, you'll notice that he's changing, he's modifying in positive ways his criteria for reopening. He's adding things and that's what you should expect. You have to be. It's called malleable, bendable, changeable, and fluid. In this environment, knowing that we are going to get to the end, no matter what. That's one of the most comforting things that Dr. Derry has ever said. He said it this weekend. It might have said it Friday on the radio. This is going to end. We don't know when, but it's either way. Natural immunity, artificial immunity, find a cure. At some point, this will be behind us, and we'll be living in a new world. And it's just a matter of when you accept that you're in a new world, how well you adapt. The mask that we're talking about. We really, really have to be careful. Tensions are high right now. Tensions are high. I will say that there are certain demographics like African-American men that need to be careful about wearing masks over their face just because of the history of profiling and the bad things that can happen. I'm actually advising African-American males to not wear a scarf if they can help it, because you don't want to give the perception of threat to anyone. Be it justified or not. We want to keep as many people safe as possible. I will be wearing a face mask of some sort and not a scarf. You're going to start to hear the China and the U.S. I'm starting to hear more chatter about who did what. Listen, the politics of it is fine, and we can have those discussions, but the virus is still waiting. So my focus is on the science. I want people to be safe. You're going to hear a lot, and that's fine, but don't let it distract you from the fact that you need to practice social distancing. You need to be scientifically, that's what we're trying to do, is guarantee you to be scientifically smart when you go out. Stay in your 6 feet. Know whether or not you should go out or not. Question whether or not you should go out now. Think about the extremes of age in your family. Would you want your grandmother to go out and do what you're about to do? Would you want your child of under age 5 to go out and do what you're about to do? And would you feel safe? If the answer is no, stay home. Don't do it. Follow the science. We don't benefit. None of us benefit. Dr. Derry and I, we are parts of the community. We don't benefit from staying inside. This is not a comfortable state of being, a comfortable state of growth, but it's something that we have to do. Doc, I wanted you to elaborate specifically on that last bullet, because that one got my attention.
I didn't think these were volunteers. And they were passing out masks, and unfortunately, I didn't read this whole story in detail, but this is what happens when you are working in a high-risk situation.
Well, understand, and coming from your perspective, when Ebola is the one that people really can identify with. A lot of people can identify with. When you were on the front lines of Ebola, when you would go see a patient, when you would go into a community. Just because you're going to do good work doesn't make you immune, Doc. Were the rules any different for you?
No, I mean, when I went in to go track cases, when I was doing contact tracing and doing clinical epidemiology, I was just very careful about where I put my hands, or I'd be wearing gloves, and I never touched myself while I had gloves on. So, we would get tips as to who was sick. We would, go into people's homes and with the authority of the police and we were able to enter people's homes, and I was able to diagnose people in their homes and then get them sent off to the hospitals right away. But again, I had a whole bunch of this with me everywhere I went, just hand sanitizer, and used it copiously. And then just through my, just kind of wore gloves. Oftentimes I just didn't touch anything. I opened up stuff with my feet, and then when we were done, we would always wash our boots off. Oftentimes when we would actually go in, actually, I forgot about this. I totally forgot about this. We would wear shrimp boots whenever we would go virus hunting. It's a memory that I completely.
I'm trying to see if I have shrimp boots.
I completely forgot about it. We used to wear shrimp boots whenever we'd go Ebola hunting because we would be able to wash them off. Yeah, it was stuff like that. I totally spaced that out. We used to wear, because I'd be like, why would I? Like, I wouldn't have washed my shoes off. I'm like, oh yeah, we used to have shrimp boots. So whenever we would go and do contact tracing and find patients, that's what we would do. So I think we should probably wrap up here, Eric, unless you got anything more to say. We ask that people please visit our website, noisefiltershow.com. Please sign up for our daily podcast as well. And please complete, there is an evaluation attached to this. Please complete the evaluation. We are paid